This conference will now be recorded.
Hello everyone. Hi Shilpa. Hi Avni. I hope you all are doing well.
Hello, ma'am.
Hi. So this is going to be our introductory session, and I'll be briefing about what MRCOG is all about, what Part 1 examination means, and how the questions are going to be, what are the subjects that we need to concentrate, how we are going to go ahead with the course, and the preparation, the recalls that we are going to do. So, as far as MRCOG is concerned, some of them must be aware about how the pattern of exam is or what it really means. But for the students who are not aware, we are going to discuss about this global exam. The Royal College of Obstetrician and Gynecologist have started this exam, and it comes under three parts. So part 1, part 2, and part 3. Part 1 exam consists of single best answers. Part 2 exam will be having single best answers as well as extended matching questions. So I'll be telling in detail about them during our part 2 interaction. Part 3 is an OSCE system where face-to-face examination is conducted, but it is in the form of circuit where there are role players. They are not real patients as such, but they are role players, and you need to sit across the table and have the discussion with them. So it is a kind of a circuit that you complete all the 14 circuits stations together. Now, MRCOG Part 1, all the major sessions are going to be taken by me. I'm the course director and chief mentor, Dr. Rashmi Patil. And there are a lot of materials, books, and PDFs that are being available. And in the market also, there are a lot of books available for purchase as such, but we need to concentrate on certain RCOG recommended things as well. Plus, I'll be telling all the smart tricks about how to approach for the exam as such. This is a global exam. It is considered as gold standard in many of the countries, UK and UAE countries, Singapore, Hong Kong, and a lot of other countries. And even in India, the awareness has increased. And currently, they are encouraging all the Indian students also to take up this exam. So there are a lot of conferences happening in India, plus the convocations have started being conducted in India as well. As I said, this comes in three parts. Part 1 and Part 2 exams, they are purely online, and they are from the centers called as the Pearson VUE centers. What you need to do is you need to go to the center with your ID proof, which is having the same name as your registration that you have done in the RCOG account, the website. I will also tell you about the website now. And it is going to carry the same name. These centers are being recognized by RCOG, and those centers are being trained to conduct these exams. So you are allocated a particular center. There you should go and give the exam. So I'll be telling you regarding the booking as well. When the booking dates are announced, close to that, I'll be giving the voice notes also about how to go ahead with the booking. So you'll be logging in, and you'll be selecting the city of your choice, and there the center which is allocated is will be allotted to you. Part 3, currently it was online, and then it has been changed to face-to-face exam. So that is how RCOG wants it always. So because of the COVID reasons, they had conducted online exam, but now it is completely changed to face-to-face again. The first step in the RCOG is going to be creating an account in the RCOG website. You need to give all the authentic information, your postal address, the mail ID, where you will be communicated throughout and even after that. So it has been like 4 years that I've completed my MRCOG, but whatever mails communication happen, it happens through my valid ID. So you need to give an authentic email ID, which will be there for reference. And whatever communication, booking tokens, exam results, whatever communication they have to do, it will be to that email ID itself. The postal address is just for the reference, but you need to enter that so that they understand from which country or which band you are going to belong. The RCOG, once you register, you create an account in the website, you will be given a college number that stays for your life. That number is very specific, and for any future referral, you are supposed to use that college number. Eligibility form, you need to upload that eligibility form. It may take at least 4 weeks for them to process after you have submitted that. So I encourage all of you to do that because March, the deadline is going to come. I'll go through the dates as well now. So you need to upload your eligibility form, your primary medical degree, that is sufficient. And there is a form which you need to fill in your basic details. Along with that, you have to attach this and send to the college ID. So everything, the communication, the mail, everything is there on the website, which I'll be guiding. There you have to upload your eligibility. Once it is uploaded, the college will take minimum 4 weeks for them to respond back and tell that you are eligible to sit the upcoming July 2024 exam. So make it as soon as possible. So this is how the website is looking. This is a new website. Previously we had the other version, so they have updated that now. And if you go into the careers training, everything, so they will be getting all the exam related stuff. So I'll just quickly show you regarding the this. So I'll quickly go through the website as well, and I'll show you how to go ahead with that. So if you're going to go to this particular thing, so if you go to the careers and training, and under exams, you're going to get your MRCOG specialty training exam, that there's a book and exam, and DRCOG. So we are interested in this booking an exam, and they will guide you step by step how to go ahead with this. Okay, so this is the basic information, and these are the details about your part 1 upcoming dates and fees. So we are interested in this Tuesday 2nd July. So as you can see, I will go through these dates again, and there are fee structures which have been displayed. So you need to click on this particular icon to see which band do you belong and which country falls under which band. So for Indians, it's the band B, but do confirm again. So see which band you belong, and then you have to um, go and pay this much amount of fees over there. Now this is the register or the sign in that you're going to get on the right hand side on the top. So there register sign in will come. So there you need to click and create your account. So for me, if I'm booking something, so you'll be getting your college number, everything, and this is the main page where everything gets displayed upon. This is very much important because all your guidelines further, so they are going to be over here, and whatever the upcoming things are there regarding exams, everything is available on this particular website. So just go through the website once, create your account, register yourself, browse through the website, just get familiar with this website. Now, what about the dates that they have announced? Part 1 eligibility, the deadline is 15th March, Friday, 2024. So all of you, I would say that right away, tomorrow itself, just create an account, fill in the eligibility form. It hardly takes like a couple of minutes to do that. And you need to upload your eligibility, the primary medical degree. There are certain criterias, attestation, everything, either from the you can get it done from any solicitor or any RCOG member itself to upload your documents. You can do that. Once they tell you that you are eligible to sit the exam, you get a confirmation mail from RCOG that yes, your eligibility has been assessed and you can sit the upcoming exam. After that, the next step is expression of interest. Expression of interest means you are interested to give the July 2024 exam. So once your eligibility comes, then you need to just, expression of interest is nothing but just a kind of form which you need to fill online in your website itself. Once you log in into your account, go to the MRCOG part 1, you will get expression of interest. You just have to click that, fill in some blank space that have been given and submit it. It hardly takes few seconds to do that. So once you submit that, the RCOG will understand that you are showing an interest to write the upcoming July 2024, and only those people who have filled in the expression of interest, the booking token will be sent through mail. Booking window of this application, it is going to open on 23rd of April. So I'll be updating and reminding all of you the dates also regarding the same in the course Telegram group as well. So 23rd of April, the window will open. What it means, you have to log in into your mail. You have to click that booking token that you have received. Once you have clicking that, it will lead you to another page where you need to fill in your details, enter that, and then select the particular center that you want to sit exam. For example, Bengaluru you're sitting. So you need to click on Bengaluru, and after you do that, the confirmation mail will come to your registered mail ID that yes, you have booked this. So booking and confirming the fees, everything has to be done. So ideally, I would suggest a credit card that you have used for international transaction. If it is there, you can go through that. Go through the fee structure also and check the limit of your credit card so that your payment does not fail. Or keep one or two credit cards handy, or even a friend also can help you with the credit card. If in case if yours doesn't work, use another card and then you can transfer the amount. So sometimes there can be challenges while doing the payment. Ideal one is a credit card where you have already used for international transaction. Check the limit of that credit transaction as well, and keep one or two other credit cards of friends, phone numbers, anything handy, so that in case if you're not able to do the payment, you will be able to do. So I'll be going through the payment, everything regarding this booking window when it's going to open. We'll be having a chat regarding the same as well. Now, booking window closes, they have given us 30th May 2024. But trust me, 23rd April itself, majority of the seats will get filled. So you are supposed to log in at that particular time itself, convert 8 a.m. UK time to your country's time, and you have to be ready on that particular time itself. So within like a few minutes or this, most of the seats would get filled, and sometimes the center that is closest to you may get blocked completely. So it is better that the time the booking starts itself, be ready with all these things and go ahead and book your seat, so to avoid any disappointments later. Usually within a month after the exam, the results would come. So here they would keep at least 28-30 days time. So results tentatively what they have mentioned is 31st July 2024. So Tuesday, 2nd July 2024 is our target. That is the exam. The results would come on 31st July 2024 tentatively. Now, booking process, these I have gone through all of this. So read all the full details before submitting the expression of interest is what they tell, and log in into the country's location. So obviously we are using a laptop, then go to the Pearson View Center. The candidate who has booked into a country location will be contacted and scheduled a slot in that particular Pearson centers to go and give the exam. And candidates are only permitted to book into Pearson View Center in the country location they have chosen. So whenever you're giving an address, so if you're typing an Indian address there, they will categorize and they'll give you the centers in India itself. And the one preference would be the city that you have chosen. And in case if that city, everything is blocked, then you have to choose the nearest one. And then that the location that you have chosen, booked and paid for, that would be the preference for you. So the part one fee structures, and they have mentioned it is like for the band B, it is £555 over there. So fees are banded according to the international membership subscription country bandings. So you need to click this blue link to see which band your country falls under, and then you should be prepared to pay this much amount for the exam fees. So eligibility, expression of interest that I was speaking about, and how to book this exam. If you just go through this link, so there is careers training exams, MRCOG, specialty training exam, click on MRCOG part 1, and then you need to show here the eligibility, expression of interest. If you click that, this page is going to open, and then you need to scroll down, and this is how it shows. Your eligibility part 1 form is there. You need to download that, fill it up, and again you need to mail them the filled PDF form. Okay, so you need to save that and then upload it to the mail as an attachment. So if you have already taken the part 1 exam before, so you're already eligible to sit the exam. So for that reason, you may not have to show this eligibility again, because once assessed means you're eligible to give the part 1 exam. Only thing that you have to do is show the expression of interest in the upcoming exam. So all these candidates, they have to show this expression of interest form. So if you click this, how to book a place on MRCOG part 1, the expression of interest, here is the expression of interest that you need to click open. Once you click open, you'll be getting the form, and that you need to type in and just press the submit. And for any other thing or contact, they have these mail IDs, and they have told that for any reason, something that you want to discuss or you want to raise a concern, you can mail them at exams@rcog.org.uk. So all these things, details are available on the website. At any point of time, you need to contact RCOG. So you will be getting uh, the link here. Now, speaking about the syllabus as such, most of it we have studied in our MBBS, and these subjects are going to be repeated, but whatever is related to obstetrics and gynecology, that is given prime importance. So anything and everything that is related to obstetrics and gynecology, it could be your physiology, endocrine, biochemistry, anatomy, embryogenetics, biophysics, epidemiology, statistics, data interpretation, pharmac, micro, patho, and the clinical management, immunology, the everything that is there related to obstetrics and gynecology is given importance. And they mention the division of part 1 and 2. So you will have two papers of single best answers. The part 1 would consist majorly of anatomy, biochem, embryology, endocrine, epidemiology, genetics, and physiology. So if you look into the major portions here, anatomy is having a good hold. Your physiology and endocrinology, they are taking the major portions of your part 1. Speaking about part 2, most of it gets distributed: biophysics, clinical management, and data interpretation. So these two things are very important, and we most of it we practice on day-to-day basis. But whatever the RCOG guideline would mention, so those we have to apply when we are solving these questions. So green top guidelines are the one that are available on the RCOG website. I also provide them, and brief summaries, everything would be uploaded in your website so that you can quickly go through them and get a gist of it. What I would suggest is the preparation should be simultaneous. Whenever you're doing this clinical management, data interpretation stuff, these are related to your part 2 preparation also. So whatever you're studying for your part 2, the guidelines, the same questions are going to be formed from them, and most of it is like practical aspect, and we just have to look into. But the answers that the GTG mentions, the Green Top guideline mentions, it should be chosen. Immunology, microbiology, pathology, and pharmacology also form the good chunk of your paper 2. Depending upon the knowledge area, what they suggest is the clinical skills would be like you understand symptoms, the risk factors that are there in the pregnant women or any gynecological conditions, the physical science, investigation, how to interpret that particular data. When it comes to teaching and research, there is a difference, or I could say change in the terminologies that we do. What we do in our country may differ from what UK does. Only the terminologies may be different, but most of us are doing research. Most of us are auditing ourselves. And the same things, especially in the medical colleges, if we do the thesis work or the submissions, it is nothing but the audit or the research that you're doing. But the names could be a little different in UK. So whatever the principles of screening, the clinical trial designs, be it multicentric randomized control trial, a basic statistical things are going to be addressed in this particular paper. Teaching and research or biostatistics, these things, especially it is dealt by biostatistician. So he's from Delhi, Dr. Archesman. So he'll be taking a biostatistics combined for part 1 and 2. The session will be scheduled and intimated accordingly. And the level of evidence, whatever the risk, the power of study, significance, the research purpose, all these things are going to be taught to you. And trust me, they are going to be very easy. Speaking about the core surgical skills, a major like the issues would come up with the consent forms, how we are supposed to take a consent, where documentation is extremely important. The surgical procedures, the safe methods, how to keep the patient safe, how to keep the mother and the baby safe, what are the complications, the risks involved in that, and the success rates otherwise, and understanding how it is diagnosed, the best diagnostic modality that is available, most accurate. So these things are the catchy words that you should know, and the treatment of complications as well. First of all, you should identify what are the complications and then how to go ahead with that. There is a term called clinical governance, which involves most of it, like For example, there is some complication that has arrived, how you debrief the patient regarding the same, how you document that, how you do the discussion with your colleagues and seniors, how you report that particular complication or incidents that has happened to the authority, how the charges are taken, what investigations happen internally. That is called risk management again, and what is the outcome, how it is communicated to the patient. All these things are very much important, especially when you come to your part 3, you understand how to speak up with these terminologies and how to deal with the patient who is upset, angry, all these things. So I'll be teaching that in your part 3. Now, demonstration about the surgery, surgical methods may be important, especially for your part 3, but common surgical skills we are supposed to know for our part 1 also. For example, the layers, abdominal layers, what are there, which are the vessels, the nerves, and what are the complications or the risks involved in that particular procedure. Common surgical instruments and the sutures, where which type of suture we are using, what are the suture materials for your episiotomy, what about the third and the fourth degree tear, how it is repaired. So there are particular things mentioned in your green top guideline which we are supposed to do. We may be using different sutures in our clinical practice, but we are supposed to mention what is there in the green top guideline itself. And demonstration about the knowledge and basic surgical procedures. It could be like diagnostic laparoscopy, hysteroscopy, laparotomy for the ovarian cyst, ectopics. Then what about the steps of hysterectomy, both abdominal, vaginal, and the degrees of prolapse, incontinence, vaginal hysterectomy procedures as well. So all these things are basic ones, and they do expect an ST5, so the specialty trainee 5 in UK, who is equivalent to your post-graduation and 1 year SRship done. They do expect them to do certain amount of laparoscopy and hysteroscopy, at least the diagnostic ones and the minor procedures. They should be aware about that. So that is important for your MRCOJ exam. So you may be doing it in your clinical practice. If not, get familiar with those procedures. Now, to know the principal procedures of complex surgeries, cancer endometriosis, and safe surgical instruments, sutures, as I discussed before, and team working, risk management, and risk reduction. For example, if there is some complication that has happened or misdiagnosis, what next you're supposed to do? You have to analyze it yourself, that what went wrong, what could have been done better to prevent this from happening in future, and how I can avoid this in future. What precautions am I supposed to take? It could be like an ectopic pregnancy. She came with pain and bleeding, and we thought it could be a miscarriage. Ultrasound was not done, but patient suddenly collapsed. The initial differential diagnosis, what was thought was a missed miscarriage or a kind of inevitable something, but later on we found out it would be a ruptured ectopic. So next time, whenever patient comes with pain and bleeding, we have the background differential diagnosis. It could be a miscarriage, it could be an ectopic. So there are situations where things would have gone wrong, but we should learn from them and prevent this from happening in future by applying what we have learned from our previous cases. So a kind of reflective practice is what this is called as. Um, about antenatal care, yes, we should know the maternal, anatomical, endocrine, and the physiological adaptations that happen during the pregnancy. Most commonly asked questions, these are: what are the changes in the pregnancy? How all these three factors are going to change? Pathology of the major organ system, especially hemoglobinopathies, these are very much common, and to some extent the connective tissue disorders, whichever are applicable to pregnancy related. So those things can be asked in your exam. There are screening tests which NHS follows. So those all things will be updated. About the anatomy of the fetus, very much important. Anomalies, embryology, endocrine, the functioning, physiology, the fetal circulation, all these are important for your exam purpose. It is just like kind of brushing up our initial knowledge or the basic knowledge that we have got. And normal fetal physiology, the development, how about the growth, how the growth assessments are done, the liker components, and when is it maximum. All these things are being asked in your previous exams as well. Now placenta, again, the development, the complications, there are genetic conditions, inherited disorders, all these are important. Your basic ultrasound findings, the scans that are done in the early pregnancy, the Doppler studies or the growth interpretations you need to know, and maternal, neonatal, perinatal mortality or morbidity, and the data that NHS produces, that is important. that also will be discussed and taught to you. And social deprivation, pregnancy outcome, if any other factors are there, especially the mental health is given prime importance, and those things also have to be assessed. Now, maternal medicine is a big chunk itself. So there are so many conditions in the maternal medicine that can be like she has come as a preconception, or she has already conceived and she is on certain set of medications. We need to know what medication she is on, whether they are teratogenic or not, which have to be maintained, which have to be changed, which dose alteration has to be done, any other new medicines that has to be introduced, for example, folic acid, ecosprin, low molecular weight heparin, all these things have to be assessed. So what medication has to be taken out, what has to be introduced, or what dosages have to be changed. This is very much important in maternal medicine. The systems involved could be different. It is diabetic or endocrine, anything respiratory, cardiac, hematological. It could be bowel related also. Pathophysiology, the presentation of common infections is very important, and any maternal diseases which could have the potential effect on the maternal and fetal complications that have to be studied. So most of this, they are all guideline based questions. Imaging methods are available, for example, ultrasound, X-rays, MRIs, how to interpret these studies, that is also important. The labor management, NHS has certain protocols, and there are WHO labor care guidelines have come up, and a lot of assessments are important, especially the single best answers. For example, if the patient has gone in labor, so what dilatation we are expecting for a primi and for a multigravida, when we are supposed to do artificial rupture of membrane, following that, how many hours later are we going to do reassessment, and whether the contractions are adequate or not, with the need for oxytocin or augmentation is required or not. Everything has a protocol. So we need to know every answer is based on these protocols only. So that also will be taught to you all. Basic physiology, biochem, or endocrine related to parturition. Again, that is important. The maturation of the fetal endocrine system, how the hormone signaling happens, how the myometrium contracts, everything is important for the exam. Similarly, the tocolysis is itself a very good topic to discuss. So that also the preferred medications are going to be discussed. The fetal physiology, then latent labor, how to interpret the results, all these things are important for us. The placentation and its implication on the labor. The delivery mechanism involved, the normal mechanism is again commonly asked. The third stage is important, how to prevent the postpartum hemorrhage, what are the drugs used, stepwise how you need to act, all those are having guidelines. Acid-base imbalance for the baby, the cord blood analysis. However, FBS is not that important, but now if the cord blood is showing some pH changes, that is also important for us. The following delivery, the perineum, the sutures, the third and the fourth degree tear, all those have the particular guidelines. The incidence of these tears in primi, in multi, the recurrence in the future, all these percentages are important. Coming to postpartum problems, the changes that happen in the neonate lactation phase, uterine involution, puerperal complications, sepsis, mental health, the contraceptions, and the lactation period, and the whichever are suitable. And in gynecological problems, again, anatomy, physio, histopath of all the pituitary, how it acts, the puberty, menopause, cyclical changes, ovulation, the benign gynec conditions like ovarian cyst in the premenopausal, postmenopausal, what are the infections, like for example, the vaginosis, trichomonas, it could be, or any other like fungal infections, those are important. Chlamydia is a very important topic in NHS. And other benign gynecological conditions where endometrial hyperplasia could be there. So they have particular guidelines, and they have the stepwise protocols how we should follow. About subfertility and treatment, NHS has the HFEA which monitors all these things, and they have their particular guidelines. The NICE guideline has come up with, and the anatomy development, cell biology, the male and the female reproductive tracts, what are the variations or the anomalies that we see, that is also important for us. About sexual and reproductive health module, the physiology, endocrine, the pharmacology of contraception, the STI detection, prevention, the microorganisms, the drugs which are used for treatment. termination of pregnancy, the consents regarding the same, the capacity of a teenage girl to decide whether she wants or this. So we have to assess the mental capacity in case a teenage girl comes up with asking for emergency contraception or she wants a termination of pregnancy. So there are certain Fraser competency or Fraser Gillick guidelines, what we say, how to assess her mental capacity, whether she is able to understand everything, retain the information that we are providing, and she's able to make a choice for herself. And what is the age criteria where she's allowed to take a decision for herself, where you're involving the Child Protection Act or the Child Protection team over there. The Child Safeguarding team comes into the picture. And which are the drugs that are used for medical termination of pregnancy, and what are the clauses under which it comes, and then we have to look into the dosages as well. The early pregnancy care, again, the basic the development, the maintenance, miscarriage, ectopics, trophoblastic diseases, or it could be recurrent miscarriage. It is a new guideline that has come up now. And all these things, they have particular green top guidelines, and whatever will be taught to you, it will be based on those guidelines only. And how to interpret pregnancy of unknown location is a hot topic again. Now, gynecological oncology, there are FIGO guidelines which have come up new, and that is also essential. The surgical anatomy, the cancer biology or the genetics that are involved. Some are risk reduction surgeries or fertility preserving surgeries are also there. That is important. The principles of radio and chemotherapy will also be discussed in brief. Now, what is the pattern of this part 1 exam? This would consist of a computer-based test, as I mentioned, and those who pass part 1, they'll be eligible to get the part 2 exam. And there are two tests, the computer-based tests that are there, and each paper would consist of 100 single best answers. Each paper would count to same amount of marks. For example, your paper 1 would be 50% and paper 2 will be 50% of the overall markings. There is no minimum score that is required to pass in each paper, but the outcome is determined only by the candidate's overall combined mark. You may score a little less in paper 1, but you score extremely well in paper 2. That is still okay. You may score borderline in both the papers and still be able to manage part 1. That is fine. You may score excellently in both the papers and get a top marks. So this paper, everything, it does not have a negative marking as such. Duration is 2.5 hours, like 150 minutes. The number of questions are 100. There is a lunch break of approximately 1 hour in between the two papers, but you do not have to completely log out of your system. You just have to submit your paper 1. Now, what to study for this exam? You have to be smart, and yes, hard work is important, but smart work will help you to save your time and be more efficient. So first thing is make an ideal ambience to study, and have one particular protocol or a particular timing for yourself depending upon your clinical commitments, your family commitments, whatever. So you need to at least make sure 2 to 3 hours you're taking time for yourself. Be very much specific what you want to achieve in your life. You are going to give this MRCOG exam, write it there, put it in front of you in a place that you look every day, be it beside your mirror or be it on a wall close to you where you sleep or anything. So your mind starts seeking whatever you're seeing, right? So first thing is that you are going to do this exam, you're going to clear all the three parts in one go. That should be your aim, and you're going to start your preparation from your day 1. Choose the study material that I'll be providing, so you should be very much wise to how to smartly work on your study materials. If there are any unfamiliar points, you just have to jot down, so that can be discussed in the Telegram group as well. There are theory books available, yes, but they are for the detailed study, I would say. You can choose to read them if you have sufficient time, if you are able to contribute some more time for yourself. I wouldn't say the textbooks that we routinely follow during our post graduations are helpful. There are particular RCOG books that I have put up in the Telegram also. There, most of these questions are based on them. And currently the trend is a bit changing. They are planning most of these questions based on your green top guidelines, or the TOG articles, means the obstetric and gynecology. They have articles which are released 4 times in a year, and each issue will have around at least 8 or 9 articles. So every it comes in Jan, April, July, and October. So those are called as dog articles. So they are very much important for part two, and some of them are applicable for your part one as well, especially in your clinical management data interpretation. So which I'll be picking up based on the previous questions that were asked, and then including that in your exam preparation. The web portal, it has access to subject wise questions also, and you will be getting an access where the live sessions that are happening, the recording of which will be uploaded in the website. So you will be able to go through that recording. So the access will be there till your July exam. So once you have done, by chance, if you are not able to connect to the live session, so you can log into the website and listen to the recording, that the session that we have done previously. And whenever you want to revise, like in a week and time, when you want to revise back whatever you have done in that particular week, you can refresh that and again go through that. There are practice books. The answers may differ sometimes if they are the old books and the publication is older one, and then the guidelines have come up as the new, and there are certain subtle changes that have happened in the new guidelines. Sometimes because it's an old edition, it may not be updated in the previous in the books, but we have to be smart enough. It not do not blindly follow all the practice books. There are a few guidelines which are upcoming, so the values may change, or the protocols may change, the mode of delivery or the week of delivery may change sometimes. So we should be smart enough in those things. What is important is the question. So the question with an authentic answer. So most of the time, the guidelines would have remained, or the book would be an updated one. So it wouldn't change much, but just do not blindly follow everything. Try to apply the knowledge in those questions that you're solving. And previous years recalls, they are very much important. Share a couple of them with your Telegram group as well. Now, this MRCOG part one, this is the RCOG book that we all should read. It's for your preference and for your guidance as well, given in detail. And most of it I will also be teaching in your live sessions from this particular book. So most of it, whatever is given by the RCOG book, we are supposed to read that first. The second one, it is revision notes for MRCOG part one. So the Oxford book, this is very important, and they have some quick revision points as well. So which also helps. Tim chart also helps in clearing the basic concepts. This is also important. Then there are other books, Philip and Baker's, so you can just go through them. But I would say do not stick to many books. At least the first three that I have mentioned, those are very much important. In the web portal, you will be getting your live session recordings. There is question pool. We are uploading all the images or relevant topics as and when we are completing your sessions. The image library will also be provided. Important summaries will be given access to. And towards the end of your course, you'll be given a free mock exam to attend. There are certain single best answer books that are available. So Pass MRCOG is a very good compilation of all the single best answers that was asked previously. It is a must book, so you have to go through that. But again, answers are, as I said, there are certain changes. We have to be updated with the recent guidelines. We also have Andrew Sizer's part one books, then Ankush Raut is there, and 550 SPAs is there. These are important for your good read. What I would suggest is go through the recalls as well, go through the session schedule that I have been put up. That one particular week, you need to concentrate on that subject. So whatever questions, anything that you're coming across, it should be related to that. Your revision, everything should be related to that. Minimum would be at least like 1 hour per day you're spending. Ideal would be 2 or 3 hours every day. And whatever doubts you're getting, please put it in the Telegram course group so that we can solve them then and there. So tag your mentors, try to study together in the Telegram group as well, so all of you can succeed together. This is me during my MRCOG convocation. So I cleared my part 3 exam in November 2019. Followed by that, in February 2020 was the convocation in London. And this is the time when the convocation happened. following that, there was COVID, and by the time I returned back to India, the next month onwards, March onwards, there was complete lockdown. So ceremony did not happen for like couple of years. After that, they resumed ceremony. Before that, they were just allocating or sending the certificates through postal things, and later on, they resumed back the ceremonies recently. So I was lucky enough just to get the degree and come back to India, and then there was COVID. But they have worked on it. They conducted exam after a time frame when they shifted everything to Pearson View centers. They conducted part one and two online. And then part three also they experimented and conducted successfully online exams. Most of the candidates they were able to clear that through online interactions. Then they wanted to stick to the face-to-face for the part three. So they kept part one and two as online for Pearson View centers, and they shifted the part three to face-to-face again. So currently, under safe precautions, everything, they are able to manage face-to-face in the previous exams as well. So I want all of you to have that feeling when you're going to go there and get your degree. The convocations are happening in India as well, but I would suggest if you're getting an opportunity, please do attend the convocation at the Royal College itself. It's a wonderful experience. So I am here, your director and chief mentor for Rayz Academy, and I wish you all a happy studying from the entire team. Let's start the journey together. And any queries, anything that is coming up in your mind, you can put it up in the Telegram group as well. You can text me, you can tag me. So whatever doubts are there, we will clear there. So I want all of you to start your preparation from day one. Have a focused study. There are commitments that we all have, but when we are dedicated to this particular exam, the constant preparation or the consistency in your studies is going to matter a lot. Along with that, be smart enough. It's not like you're reading one chapter for like one complete hour. You just have to grasp the gist of that particular chapter and go ahead. At the same time, don't overlook the key points given in the chapter. So it is important that you build your concept clearly. Whatever the exam is going to be there, you will be answering it that correctly. Even the questions are being twisted or the questions are reframed, you know what they're going to ask, and then you're able to justify that answer. So the concept have to be strong. Your basics have to be strong. The knowledge, it has to be strong. And that comes only when you're reading all these materials backed up with the guidelines. And part one and two, when it comes for clinical management and data interpretation, if you're reading your Green Top guidelines along with your part one preparation, it's going to help tremendously in your part two preparation as well. So it is just going to be a revision when you're doing your part two. So all the best. And this particular introductory session, again, it will be put up in your website also. At any point, if you want to go through this again, so you can go through, and whatever the RCOJ account, everything, if you have not opened that, please open an RCOJ account, and you need to put in your eligibility form. You have to upload that and send a mail to RCOJ as well. Thank you so much for attending the introductory session. If any doubts are there, I can address them. Any doubts you have?
No, ma'am.
Okay.
Everything
Yes,
was
then we will
clear. If you
be
have any doubt, we will message you, ma'am.
sure, sure, sure. Thank you so much. And good night. Take good care of yourself. So let's start this journey together. And the schedule has been put up in the Telegram. So every month before the last week, so we'll be uploading all the schedule for the next month. Please try to attend the live sessions only, so that if any doubts are there, we can clear it off in the live sessions. And apart from this, yes, Telegram group constant support will be there. So whatever you have, just put up a message in Telegram. So as and when I'll be seeing that, we'll be answering that question as well. Thank you so much. Take care. Good night,
Thank you,
all of
ma'am.
you.
Thank
Thank
you, ma'am.
you.
Thank you.